Hi, I'm Preeti Shah. I'm integrated nutrition health coach. Today's video is about cholesterol. Cholesterol numbers are very important to keep in control for reduced heart ailment, stroke. It is also directly associated with higher blood pressure and diabetes. So today's video is about cholesterol, various types of cholesterol and diet to keep the numbers low. Cholesterol is a pale yellow waxy substance found in blood called lipid. It is a type of a fat. It is essential for our body just like food, water and air. Although it has got a bad reputation, but it is essential for our body and approximately 70 to 75% of the cholesterol is made by the body. It helps in producing hormones, vitamin D, few enzymes to digest food. It is work as a building block for a cell. So cholesterol is essential for our body. We just have to be careful with too much of cholesterol or wrong kind of cholesterol. For years, doctors have followed the practice of keeping cholesterol number below 200 mg per deciliter and LDL cholesterol below 100 mg per deciliter. Current guideline is to check person's entire cardiovascular disease and bifurcating between various types of cholesterol. Now when we talk about various kinds of cholesterol, LDL, which is bad cholesterol, HDL, which is good cholesterol, and triglycerides, which is ugly cholesterol. On these three cholesterol numbers, the focus is given. LDL is a bad kind of cholesterol. It builds a plaque in the arteries and clogs them, which increases risk of heart attack and stroke. Target should be to lower the LDL, and with the 10% lower LDL, it reduces risk of heart attack by 7%. HDL is good type of cholesterol. It helps clearing up bad kind of cholesterol from the arteries. So idea is to increase your good cholesterol. And the third is ugly cholesterol, which is triglycerides. It is more associated with the increased number of heart attack and stroke. So you need to focus on reducing triglycerides. Now let's discuss diet for cholesterol. So for cholesterol, fatty food is a problem. Fat influences directly to cholesterol. So in cholesterol, wrong kind of fat and too much of fat is a problem. There are three kinds of fat. One is saturated fat. Second is monounsaturated fat called MUFA. And third is polyunsaturated fat called PUFA. Thumb rule is to reduce saturated fat and increase unsaturated fat for decrease in heart attack and stroke. Saturated fat we get from milk and milk products. So cheese, butter, cookies, all the dessert products, ice cream are all loaded with saturated fat. It is also available in meat. So red meat needs to be consumed in moderation. It is also available in abundance in few plant oils like coconut oil or palm kernel oil. It is recommended to get less percent of the calorie from the saturated food. MUFA and PUFA can be eaten in place of saturated fat. That you can get it from avocado, olive, various kind of nuts and seeds, peanuts, fish and canola oil. And the third very important thing is about trans fat. There is a process called partial hydrogenation that transforms unsaturated fat, mainly MUFA, into so-called trans fatty acid, which raises LDL cholesterol even more than saturated fat. Usage of trans fat has increased dramatically in recent years because they are cheaper than healthier fats. They can make food tastier, crispier. It can increase shelf life. So it is suitable for variety of processed food products, and you get it from margarine, vegetable shortening, vanaspati ghee, fried food, baked goods such as cracker, biscuit, pies. Baked and fried street and restaurant food often contain this trans fat. By now you must have understood cholesterol is directly related to wrong kind of fat, and we need to pick up which kind of fat is better. So when we talk about cheese versus butter, cheese is better. When we talk about red meat versus white meat, red meat is not preferable. It is processed and loaded with other additives as well. When you talk about dairy versus meat, of course dairy is preferable. And when we talk about eggs, eggs are high in cholesterol, but according to one study, eating in moderation doesn't have major effect on number of cholesterol. Eating one egg per day is okay. People also get confused when it comes to rice, potato and wheat. In this such kind of food, starch is higher and which increases blood sugar. So it is always recommended to replace simple carb with complex carb, which has a beneficial effect on LDL. Now let's discuss what can be eaten to increase heart health and reduce cholesterol. Fiber comes first in the list. It is often rich in heart healthy minerals like potassium and magnesium, also certain vitamins like vitamin C, beta carotene, phytochemicals. So increasing fiber rich food and moderation in saturated fat, it is what is recommended. Apart from this, of course, eat fruits and vegetables, lentils, legumes, pulses, nuts and seeds are must. Dairy product, you can have 2 portions of dairy, one is milk and one is yogurt. Fish you can have once a week. Alcohol should be in moderation. And finally, exercise increases good cholesterol and decreases bad cholesterol. So have an active life if you want to improve your cholesterol numbers. So this was all about diet and lifestyle changes to keep cholesterol numbers in check. But people often wonder whether lifestyle changes are enough or not, or whether they still have to start taking cholesterol medications. In that case, I would like to mention that cholesterol medications, when it is recommended by a doctor, one needs to be taken. Avoiding medication is not the best choice. So it is important to make lifestyle changes, but it is also important to take medication when it is recommended. It helps preventing further damage to the organs, and in case of cholesterol and heart attack, prevention works the best. I hope this all helps. Thank you.